Hi, good morning and welcome to the health segment on the Breakfast Show. I am Dr. Nakwiana Mfaya. So this week we have been talking about diabetes, and yesterday we talked about some of the signs and symptoms of diabetes. We say that people who have diabetes would have symptoms of eating too much, more than they usually do, or urinating frequently, and also drinking more water than they usually do. People with diabetes may also have other symptoms of weight loss and eye complications and high blood pressure. So today we are going to talk about how diabetes is diagnosed and how it's managed in the hospital or even at home. So when you go to the clinic or go to the hospital and you feel like you have some of these symptoms of diabetes, they would usually have to do a random blood sugar. And this random blood sugar tests your blood. And if your random blood sugar is on the higher side, or it's more than 140 grams per deciliter, then you'd be considered as having prediabetes. So it would have to be done on several occasions where they would have to test your blood sugar more than once to be able to ascertain that you actually have diabetes. There are some other tests that are done, such as fasting blood sugar, and this is where you fast from midnight until the following day, and then your blood sugar is checked, and if it's very high, then it means that you might be having prediabetes, and if your blood sugar continues to be high, your fasting blood sugar continues to be high for some time, then you'd be diagnosed as having diabetes. So that is how diabetes is diagnosed. There's some other tests that are done in the hospital, and when those tests are done, they can also ascertain that you have diabetes. So how can diabetes be managed, or is it curable? Is there a treatment for diabetes? So diabetes is not curable. There isn't a specific cure that you can take and diabetes is gone and you are not diabetic anymore. But it can be managed, and there are some medications that are given in the hospital that can be used to control your blood sugar and to control your diabetes. So once you have been diagnosed with diabetes in the hospital, you'll be started on some medications. And with these medications, you have to continuously take them every day. And as you take your medications, you have to make sure that you monitor your blood sugar as well, because your blood sugar can change in the morning, afternoon, evening, it changes. So you have to monitor your blood sugar every day, at least before you eat, and before you eat, whether it's your main meal or your snack, at least check your blood sugar so that you know how much it is, and then you eat and you take your medication. So it's important that you learn how to take your blood sugar on your own, because it has to be done even while you're at home. You'll not only be doing this at the hospital, but even at home, you have to know how to take your blood sugar and check your blood sugar so that you know how much sugar is there in your body. And you can also be writing the blood, the results in a diary, so that you present it to the doctor when you go to the hospital. And once you do that, it's easy for them to be able to monitor how your blood sugar is being controlled at home. If your medication that they're giving you is controlling your blood sugar, or if there's need to change the medication or to increase how much medicine you're taking at home. So it's important that you know how to take your blood sugar even while you're at home. Then when it comes to the management of diabetes, there's something called HbA1c, and this is a test that is done to show whether you are managing your blood sugar well at home. It's able to tell whether you have been managing your blood sugar well for the past 3 months. So it's important that you stick to your medication, take your medications as prescribed, and so that your HbA1c can be in the normal range. because if it's on the higher side, it means you are not controlling your blood sugar well. So these are just some of the treatments that I used in the management of diabetes. And so you need to discuss some of the treatments with your doctor and learn how you can manage your diabetes better, even while it's still at home. The other thing in the management of diabetes is your diet. Your diet needs to be controlled. You need to be able to eat foods that are wholesome. You don't need to eat foods that have too much sugar to prevent you from having high levels of blood sugar in your body. So you need to be able to work with a dietitian as well, who will be able to guide you on how much you should eat, what you should eat at which particular time. Most of the patients that have diabetes usually do not know exactly what to eat and how much to eat, because that's very important when you're managing your blood sugar, because you can be taking your medications, but if you're not controlling your diet and eating the right foods, then your medicine or the medicine that you're taking is not going to be effective. So it's important that you manage your diet as well. So the other thing that you can do in the management of diabetes is being active. So you need to be able to exercise and keep your body active during the day to be able to utilize and take up the blood sugar that you're taking, or take up the sugars that you're eating, and also reduce on the insulin resistance, because we say that your muscles are not taking up the glucose because they are not getting sensitized. So when you work out and exercise, your muscles become more sensitive to the glucose, and so you'll be able to take up more glucose from your body. So that is how you can manage diabetes, and make sure that you follow your prescribed medications and do as your doctors and your caregivers are prescribing for you. Then the other thing is that diabetes is treatable, but it's not curable. At some point, your diabetes may become controlled, but it doesn't mean that you are no longer diabetic or you should stop taking your medication. So you have to keep on taking your medication and stick to what you have been prescribed at the hospital. So that is what we had for today, and that is what we talked about today. I do hope you have learned something. We have talked about how you can manage diabetes, and that you should take your medications as you have been prescribed at the hospital, and also make sure that you're eating the right food. So you should be able to work with a dietitian to show you exactly how you should eat, and also keep active and take your medications continuously, because diabetes doesn't stop. It can only be controlled, but it doesn't get cured. So be sure to tune in again tomorrow at the same time on The Breakfast Show on CamNet TV, and thank you so much for watching.